Hi there, my name's Emily. Don't forget to hit subscribe and the notification bell so you don't miss out on any of our videos. Cardiac arrest can affect anyone at any time, and in fact 30,000 of them occur outside of hospitals across the UK each year. Unfortunately though, currently less than 10% of these people experiencing cardiac arrest in the community survive. But with speedy emergency treatment, chances of survival shoot up by a whopping 80%. CPR and AED shocks given within the first 4 minutes are crucial to enable survival. Yet terrifyingly, the average ambulance response time is longer than that 4 minutes, depending on where you are in the country and also in the world. 20% of out-of-hospital cardiac arrests happen in public places. And if you suffer an arrest out and about, you would be reliant on the public's ability to perform CPR and indeed the availability of a defibrillator. CPR alone can double the chance of survival, but when you use a defibrillator in addition to good quality CPR, the odds of someone's survival can jump from around 6% to a massive 74%. That's an incredible difference. So what is an AED? AED stands for Automated External Defibrillator. Defibrillators are the brightly coloured boxes that you might have seen in supermarkets, tube stations, railway stations, bus stations, airports, some telephone boxes in rural areas, and also high traffic areas and public places. Have a look where your nearest one is. Make sure you know where the nearest one is to your home. Does your workplace have one? If you're not quite sure where your nearest one is, there are a few apps that can help locate them. So there's apps such as Heart Start, Good Sam, AED Locator. There's lots of different ones out there. Do have a look where your nearest one actually is. Because as soon as you get one there, the better, as we said, the chances of that person surviving. Other places we can find them will be things like sports centres, leisure centres, outside pubs, outside churches, inside them. So an AED can automatically detect if someone is in a shockable rhythm, and it speaks to you, it tells you what to do. Defibrillators do not jump start the heart like starting a car. What they actually do is they stop it. A bit like when you reboot a computer or a phone. Ultimately, this allows the individual cells to recharge simultaneously and the pacemaker in the heart to hopefully restart in its normal rhythm. So basically, you know when your computer doesn't work properly, you kind of reboot it. That's kind of what the defibrillator does to the heart. So when it turns back on again, when the heart starts again, it will be beating normally. So the defibrillator will detect certain rhythms, and sometimes it will administer a shock to stop the heart if it's in an abnormal but shockable rhythm, enabling the heart's own system to reboot and hopefully restart in a sinus rhythm, a normal heartbeat. AEDs are used in addition to CPR to save the lives of those suffering from a cardiac arrest. It is not CPR or an AED, they are used together. And research has shown that deploying a defibrillator within 3 to 5 minutes of a collapse can produce survival rates as high as 70%. So in other words, as soon as you see someone going to cardiac arrest, then make sure you start CPR and you get someone to get you that defibrillator. Anybody can use a defibrillator. You do not need to be trained to do so. They talk to you.
Shock advised.
Now, using an AED is crucial to be able to have a chance of bringing someone back following a cardiac arrest. CPR is great because CPR will help circulate the blood. It will keep the heart and brain sufficiently oxygenated, but the AED is necessary to deliver the shock, which will hopefully return the heart to a normal, viable rhythm. Most sudden cardiac arrests results from ventricular fibrillation, VF. VF is a fast, erratic heart rhythm. It's a bit like you've got a jelly on a plate, so rather than the ventricles beating like this, they're going to a quiver, a bit like a jelly would. Now an AED will only be able to give a shock if it recognises one of these shockable rhythms. The machine will recognise these rhythms and advise whether to shock or not shock. So sometimes you might find the machine saying no shock advised. Please don't worry, just carry on with your CPR. talk about how to use an AED, because hundreds of people are alive today entirely due to the prompt and appropriate use of a defibrillator. For every minute's delay in deploying a defibrillator, the odds of survival reduced by about 10%. Okay, so the first thing we're going to do is D for danger. We're looking, we're listening, we're smelling for things that could be dangerous. We're approaching the casualty from the feet, and we're making sure that we talk to them. We ask their consent. Hi, my name is Emily, I'm a first aid, I'm here to help you. We'll see if they respond, we'll give them a bit of pressure on their shoulders, and maybe make a loud noise to see if they respond. There is no response. So then I do A for airway. I open the airway with a chin lift and a head tilt. And then I look, listen and feel for breathing for up to 10 seconds. So I'm looking at their chest rising and falling, I'm listening with my ear, and I'm trying to feel for breath on my cheek. Now this casualty is not breathing. So I leave the casualty now and I go and call the emergency medical services, and I make sure I grab the AED because there's one easily located that I can get in a few minutes. I return with the AED. The first thing I do is open it up and turn it on because it's going to talk to me. It's going to tell me exactly what to do. I'm then going to make sure I'm wearing the correct PPE. So I'm going to get my gloves on in this case. I'm then going to follow the instructions.
Apply pads to patient's bare chest.
The first thing I need to do is have a naked chest. So I need to remove the clothing off this casualty. So I'm going to unzip the jacket, and then I'm going to use the scissors and place a cut at the top of the t-shirt. Might try and rip it. If that doesn't work, I will then keep cutting all the way down. Remember, neck down to belly. I'll make sure that they're not hairy, and if they were hairy, I need to shave them where the pads would go. And maybe dry them if they're very clammy or sweaty. I'll get the pads out of the packet. I will have a look at the pictures on the pads because they do show you where you need to put them. Unpeel them because they're a bit like plasters. Stick one on underneath the right clavicle and the other one underneath the left pectoral muscle. There should be a hand's width distance apart between the pads.
Plug in pads connector next to flashing light.
You will then plug it in to where it's flashing and you follow the rest of the instructions.
Analyzing heart rhythm. Do not touch the patient.
Making sure that everyone is standing back, nobody's touching a casualty, because if someone is touching them, reading will be incorrect. It will analyse your reading rather than the casualty's reading. Now remember, it's looking for a shockable rhythm.
Shock advised. Charging. Stay clear of patient.
Tell everyone to stay back, so I say clear.
Deliver shock now. Press the orange button now. Shock delivered. Start CPR.
Then begin CPR. So I'm doing 30 compressions with 2 rescue breaths. Let's talk about what we would do then if there was a helper there with us. What would we do? Well, quite simply, one person will begin the CPR straight away, because remember we talked about that being really important in the chain of survival, while the other person goes and calls the EMS, and then they will make sure they grab the AED. When that person comes back, they will take over the AED while you carry on with compressions.